Welcome to Let Go Let EFT, where we are learning and leaning in with you, with your hosts Michelle Puster and Dr. Laura Spiller. EFT is a beautiful model helping people connect with themselves and the people that matter the most, developed by Dr. Sue Johnson.
Good morning, Michelle.
Hi.
You ready to talk about a really difficult topic this morning, one that can throw a therapist into kind of a tailspin. I was thinking about this topic based on a meeting I had with a supervisor who had just had a couple come in that she'd been seeing for a while and told her that they had decided to separate.
You know, this is a tough one.
Pretty relevant because it brings, up self of therapist issues. And that's one of the things that we've kind of wanted to be authentic and transparent about. Some of that stuff we say to ourselves in these really difficult moments in session, especially with challenging couples.
Yes.
So, let's just start out with what makes it difficult or what's hard about this topic when a couple comes in and is talking about maybe separating.
I think one of the hardest things is, which we won't know, but thinking through, is this someone saying that they're really separating? They need help logistically. They need help maybe sorting through how this is going to look with the kids, if they have kids or whatever. Is this, they're saying this is happening, or is it attachment distress? Is it a way of them managing their pain? Is it part of their cycle? And there are many times when separation comes up and it's not clear at first. And so I think that is one huge thing. And the other huge thing is managing then what happens inside of us, because that can stir up lots of panic and uncertainty and even feelings of like, what am I doing wrong here? That especially after the couple's been in sessions for a while, that they might be talking about separation.
Right. So I hear you kind of saying, right, there's this task that we have when this comes into the room of sorting with the couple. What is the relationship meaning, the significance of this decision? Is it, and trying to get a sense of, is this kind of a way of expressing pain and trying to solve the pain, the problem of the pain in the relationship, or have they already reached a stage of disengagement where, this is kind of where they're at and there's not a lot of hope for re-engaging. And then the second thing you were saying is that this can be super hard to do. One, because that's just a complex determination, but also because, especially when we've been seeing them for a while and they come in and suddenly are talking about separation, that a lot of stuff happens inside the therapist. I know I have that thought of, oh no, I have failed them, right? Mm-hmm. There's not enough progress, or therapy's not working, or they, I missed something important, and can get really sucked into my head with all of that. And it sure gets in the way of what we need to do in those moments with our clients.
Yes, for sure. And I think it's so natural for us to go there. I mean, it's one thing if it happens at the beginning, I think it's really common for couples to say, we called you and a divorce lawyer, so good luck, essentially, or we've already separated, we're living in two separate places, or we're talking about separation, and that's why we're here, right? That's really normal. And
I love it when they come in and say, you're our last hope. This is our last just effort. I'm like, oh my God.
Right. No pressure. However, it's sort of, we don't have any onus over what got them to that point because we just met them. But right. If we've been working with them and then they say, we are talking about separation, like, oh, because we get really invested, that's part of our job, is to hold the hope. It's part of our job to be invested and to care and to really be in it with them. And so when they bring us, they're talking about separation or they're deciding to separate, or it can be so difficult and painful. And there can be, just like, it's just difficult and painful. And then on top of that, we often add that layer of, and like you said, I do the same, of what did I do wrong here? What did I miss? What should I have done? Surely if I had done that better, or if they had this trainer, then they would be, on their second honeymoon or something, right?
So I can only find a good therapist to refer them to. But
yeah, our
yeah,
minds go there.
Sorry, say that again.
Our minds go there, to all of our, we must have failed them, which is just adding to the pain of, like, it's difficult to see them in that painful place.
Right. I've been working with my supervisor trainer, Sharon Chapcook-Lee, and it's helped me to recognize that my attachment, there's 3 attachment systems in the room, right? Theirs and mine. And that my strategy, when there's a threat to a relationship, which happens, right? And we have a relationship with our clients. We want to be, liked by them, belong with them as their therapist. Have this helping relationship. And that, my strategy is to work really hard to try to be good and get it right. And when it feels like there's this threat, I kind of immediately get critical with myself that I've sort of failed or done something wrong.
Mm-hmm.
It's been so helpful, and this is, I guess, is getting into that kind of tips, first of all, to dealing with that barrier that comes up, mm-hmm. right, is to be kind to yourself a little bit. Even just notice, right, there's my strategy coming up. That's the way I manage this.
Yeah.
When they said they were separating, of course, it makes me go, oh no. And that I can be kind and I can kind of let that part that really wants to get it right, be right there and tell that part, it's okay. This is hard work we do. You're still doing a good job. If you go into your head, you really are going to leave them. Mm-hmm. So it's okay. Tune back in.
Yeah. And I love that, because it does make me think of Kristen Neff's self-compassion, like, this is a moment that we need self-compassion, and especially not to burn out and to keep doing this hard work that we're doing, because we want to stay engaged and we want to be impacted by what's happening. And there's great upsides to that, but of course it does activate us. And so, yes, to like bring ourselves lots of self-compassion, which one way that I do that is talking with you and other colleagues, because it's going to be hard sometimes, and I'm going to need to lean on other people. And yes, like think it's working with our supervisors, getting their feedback and validation, and just normalizing what we're experiencing. And then I think it does, from that place, it's a little bit easier to look at the flip side of the coin, which is most likely if they are really disengaging and that's coming up, or that started long before they met us, and they probably have enough safety in our therapy office that we are creating enough safety that they can actually talk about what they have not been able to talk about, haven't known how to talk about, haven't been able to face. Because I'm imagining it would extraordinarily painful, even if that ends up being the right decision for them, or the right decision, the decision that they make. That's
me feel a little bit more relaxed. I felt that in my body, kind of like, oh yeah, right. How much courage it takes and how much bravery it takes to come into session and say, I'm losing hope. I'm scared. I don't know that this is going to work. And that sometimes that can only happen when we've created enough safety. That kind of felt really good to remember that and to think about that. Yeah. So if we can kind of bring a little bit of settling to that inner, our attachment system that panics, when there's a threat to our relationship with the client, we're getting this kind of potential message of, that that therapy's not working. Then we can shift to, how do we help them in this place?
Mhm.
How do we help them in this place?
Well, and, it's kind of frustratingly simple, but I think lean in, we lean in, we get curious, help me understand, how did that conversation come about? What was like, I want to, if a couple came in and told me that, ideally I would want to like sit down as if I were in the living room with them when they were having this conversation, be in the kitchen with them, help me understand what was going on just before. And I want to sort of lean in and get curious and create lots of space. Cause I think sometimes when our fear is triggered, we might want to say, oh, I don't like talking about separation is not good. I'm the marriage counselor. I'm the keeping people together person. I don't want to talk about, so we can kind of want to exit and not talk about it and just sort of like, I didn't hear that, want to move past it really quickly. And ideally what we would be able to do is lean in and explore so that we can get a better sense of, is this the disengagement, or is this attachment distress and they're part of their cycle that they get into this protective, exit mode kind of strategy. And the only way that we can do that is to lean in and get curious and let them help them explore this.
Yeah, really slow down, lots of reflection. We're trying to make all of that stuff that's going on in the inside more explicit, help them kind of see, is this a response, a way of handling vulnerability? I mean, it is, but can we slow down there and kind of help them see that, and help them see that strategy a little bit more, and be aware of the function it's playing, and just really be with them, because if they're there, they must be in so much pain. Separation, divorce is also full of suffering, right? So they're in this really hard place of having to choose, no good choices. Either way that they're going, they're suffering on either path. Mm-hmm. And they're having to figure out, right, which way do I want to go? And they probably don't have a really good vision of what it looks like on either end of those paths. They probably can't picture a relationship with their partner that feels more safe. Mm-hmm. And they may not actually, they may have a picture of, but it may not be a realistic picture of what it, being pursuing kind of their own balance separate from their partner. Mm-hmm. And helping them see those paths a little bit more so they can figure out, what's the function of this desire to leave?
Right.
Is it about gaining safety? Sometimes I've had couples come in and say that, and it's a protest, right? We all know that, right? And sometimes it's just part of the protest.
Right.
And so then especially helpful to help them see that function.
Yes. And I have the feeling that there's at least one, if not two, follow-up shows with this, one being, now that we've leaned in and we're getting curious, one is we discover, which I think is less common, fortunately for us, but that it definitely does happen, that there is disengagement there, and that there may be a leaning towards separation and or divorce. So I think that could be a follow-up show, like what happens when that it becomes clear that that's where the couple's at. Mm-hmm. And when the couple does use, or one or both use the strategy of, I'm done, or okay, I guess you want a divorce, or, I'm out of here, or actually physically separating. I've had couples that come in separated that, that is part of their strategy in the cycle, that they physically gain space. Some people leave for an hour, 3 hours. Sometimes it, elevates to moving out, separate bedrooms. There's all different kinds of separation, both talking about it, and physical separation, that's part of the cycle that we can put into the cycle. So it feels like that would also be a helpful sort of follow-up show of putting that into the cycle and being able to talk about it. And because it is so scary for us. So yeah, I guess thinking about, leaving this here today, what is your maybe final thought for if this has just come up with a couple, or if you have a supervisee or someone that's, this is coming up with their couple?
I mean, it's sometimes our answers are kind of all the same, but I mean, it's almost jokingly, right? You don't want to do anything. You want to just slow down with them, be where they are. We're not going to push for either solution. We're not going to try to problem solve here. We want to just really slow down, attune, reflect, validate. And this is probably one of those good places to try to just use reflection and validation. You can put the questions to the side, right? You're just really, really working with curiosity, validation, reflection. You want to slow down with them in this really confusing place full of mixed emotions, and help them sort it and organize it.
Yes, I love that. Right. I mean, yeah, for me, there's two main things: slowing down and leaning in and being there with them in that, because it's, that is a gift. That is valuable for them to be able to be in this painful place and talk about it and put words to us and have us be a safe person that they can explore this openly and not have to be alone in that painful place that they might often be, either in their heads, or it sort of comes out, in a fight, in a reactive way. That just slow down and be there with them in that. And like you said, notice if we're sort of like, which are you in or are you out? Like, notice if we're wanting to push, or if, push them in one direction or the other, or notice if we're sort of like, problem solving, like, oh, what should we do here? So noticing that and just sort of like, yes, okay, that's us sort of reacting to this, but can we just be there and lean in? And the other one is, just acknowledging for ourselves how hard this is, because it sounds real nice, doesn't it, to just lean in and be there with them. But the reality is that's really, really, really hard. It's possible, but it's really, really hard, because it is really activating for us. So give yourself lots of support in that, reach out to a colleague, talk to your supervisor, journal about it. Do something for yourself in that, because it is going to be it's going to be hard. It's hard for all of us. If you care and you're doing a good job and you're a good therapist, it's going to be hard. So I think that's really important as well, to take care of ourselves in that space.
Totally agree. Right? We got to soothe and kind of calm and be with ourselves and bring that compassion and care so that we can be with our clients.
Right. Exactly. That just gives me chills when you say that, because if we're in a sort of okay place, then we can be the grounded person in the room, right? We're sort of like, we can be right. We can hold the space. Yes. But we have to first take care of ourselves in order to be able to do that. So this is a really great topic. I feel like, there could be lots of spin-offs from it, but I'm glad that it came up and we got to talk about it.
Well, I look forward to talking about it more, and hopefully we can do that soon.
Yes.
All right.
Bye-bye, everybody.
Bye.